Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
What has AFEM and Abbott been doing during this whole period?
Emergency medicine is a new specialty across the world, and in Africa it's even newer and younger in many countries. So the African Federation for Emergency Medicine was started about 11 years ago by a team of people from various African countries that met for a different purpose in Cape Town, and had discussions around the lack of proper structured emergency medical systems in African countries, despite the glaring gap and the high numbers of deaths from acute illnesses and injury. And that was the birth of AFEM. Uganda has made good strides and milestones. I trained in South Africa and started my training in 2015, simply because by that time there was no Masters of Emergency Medicine offered in Uganda. There was masters in surgery, pediatrics, but emergency medicine wasn't there. And so I traveled out of the country. Right now, there's two programs. There's one in Makerere and one in Mbarara. The Mbarara one has already produced its first batch of emergency physicians. Coming to ministry level, a long time ago, there wasn't an EMS department, which now exists. And many of these efforts are because of the discussions that AFEM has had, with countries at their level, and the support that has been provided. When the pandemic hit, many of us were drawn into roles that we hadn't done before. It's a new virus. It has attacked the entire world. It's exposed a lot of system gaps in various African countries, Uganda inclusive. And the silver lining is that many countries have then had to fast track their improvement of emergency medical services systems.
How do you, harmonize the guidelines that are going to work across Africa, considering our different strengths?
All right, and that's where you need your local physicians working actively with the partnership and reviewing what is happening in your country. I can tell you for a fact that between around October, November, we had a lot of numbers, and going into early mid-December, we had a lot of numbers. Facilities were getting full, but we were not the first to get there. Other countries had gotten there already before us. Kenya had gone through that already, and they were now on a downward trend. South Africa had their wave, and they were in their first wave that was going down. Ghana, different countries had been there before us. And the beauty of the partnership is that we had series where we had discussions and countries gave presentations of what they've gone through and what they did. And so we had already anticipated some of these things and learned from them. So when we had the surge in numbers, the emergency care response was prepared for the surge. We already had, our ambulances had been beefed up. We already had protocols in place for, when we started seeing the more severe and critical cases, we had already trained ambulance teams, for example, and emergency teams in moving patients who are critical, in assessing them, and in managing them. So the protocols existed, trainings had been done, and the teams seamlessly transitioned into that phase we went through as a country, simply because through the partnership, we had an opportunity to learn and listen firsthand to what is happening in other countries and what they had done. Many countries have reached levels where they're generally able to continue on their own, but the initial stages were very critical, and it really helped.
Okay. Thank you very much for your time.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store, and distribute essential medicine and medical supplies to all government health facilities in Uganda.